Okay, we're live now.
Hi everyone, welcome to today's virtual session. With us we have Dr. Monica Wheeler, and she's going to be explaining her experience with us as an IV Sedation General Dentist. So Dr. Wheeler, whenever you're ready.
Hello everyone, I'm Dr. Wheeler. Today I have a presentation. It's not my ideal presentation, something was going wrong with that, little technical difficulties, but I'm going to show you just a few things that I do as a sedation dentist. And if you have any questions, just let me know. At the end, I think there will be a question and answer session. All right. So here's a little bit about me. I went to Dillard University for undergrad. I went to Meharry Medical College for School of Dentistry for dental school. I did a residency at Morristown Medical Center in New Jersey. And currently I'm in private practice. I also serve on the Board of Dentistry in North Carolina here as a sedation evaluator for dentists and dental offices who want to become IV certified. I've been doing sedation dentistry for about, I think, 4 or 5 years, and it's been great. So as a general dentist, this is some of the things we do, which is everything. You can do fillings, crowns, veneers, which is your cosmetic dentistry, braces, which is your Invisalign or your 6-month smiles, extractions, including wisdom teeth, which is helpful when sedation comes into play, also implants and dentures. So this is a typical setup for me. IV sedation, you see on the left side of the screen, there's a monitor, there is an oxygen card, there's sedation meds in there somewhere, reversal meds in there somewhere. Basically, IV sedation dentistry allows you to do comprehensive dentistry on a day-to-day basis. Most patients are very fearful of the dentist due to just dental anxiety. Most people in the United States have anxiety. So when you couple that with dentistry, most people have had a bad experience, or they know someone who's had a bad experience. And they really, typically these patients stay away for a long time. And what brings them in is their ability to have comprehensive dentistry done in a dental office setting and get a lot of things done at one time without having to come back to the dentist multiple times for multiple visits. So it really is an awesome tool. Now, does it come with a huge liability? Absolutely. Obviously, we know there can be adverse outcomes if you are not properly trained, which is why you have to do extensive training. It's a very serious thing. But this kind of just couples in dentistry with overall health. When you are sedating patients, just like when you're treating them for any dental work, you are putting things into their system, with as far as it could be just your anesthetic or sedation meds that can alter their heart rate, their blood pressure, all these different things. So you need to know what medications they're taking, their full medical history, everything like that. So it really just kind of brings you back to the fact that dentistry is a comprehensive field of medicine. We are treating the teeth, but the teeth are attached to a whole body who has different complications, different medical conditions, things like that. So it's very important that you get a thorough medical history when you are meeting your patients for the first time. Now, everybody thinks it's so cool, when you have your sedation appointments. I know most popular is wisdom teeth extractions and how patients typically respond from that. It's pretty cool, but it's also a very serious thing. If you are careless with just one or two different things, let's say you label the drugs wrong, or you give too much of something too fast, you really can harm a patient. The same thing with the anesthetic. So it's very important to know that this is a very serious thing. Even though it's cool, even though you can do lots of amazing things for people, it comes with a serious a price tag and liability. On the right side, usually what we have all the time is what we're doing on the patients. It's just kind of a fail safe for everyone, for the doctor, for the assistant, for anyone who comes in and out of that room. so they know what we're doing, what tooth we're working on, what things we're taking out. So here, we were doing a root canal on a tooth. And if you don't know what a root canal is, a root canal basically extends the life of the tooth. It allows the person to keep the tooth for a longer period of time, just takes the nerve out of the tooth and fills it with like a plastic sterilized material, and you usually get a crown afterwards. Also, this patient had wisdom teeth extracted. They were full bony, which means that they were under the gums, under the bone, and teeth 1 and 16 are the upper wisdom teeth. We always talk about what the patient needs to have next, and then same day treatment. So basically, this patient came in knowing that they were ready to, that they wanted to have work done. So they were probably in pain, and was prepared to come into the office to be sedated. Now, this is not your everyday typical thing. It kind of starts at the front desk for your office, where your patients have to be triaged on the phone. Are you a fearful patient? Are you interested in sedation? Which also goes back to your marketing. Patients are going to type in sedation dentist in Raleigh. And then your office will come up, they'll call your office. Your office then instructs the patient on what to do and how to come prepared to the appointment if they want to be sedated the same day. This is also comprehensive dentistry that we do. A lot of the fun stuff that you see on Instagram, everywhere, cosmetic dentistry, teeth that need to be built up, teeth that need crowns. Anytime you're doing anything involving an airway, meaning, any type of extractions, any type of work that you're doing where tiny pieces can fall to the back of the throat because your patient is sedated, while it is conscious sedation, the patients are very sleepy. And if anything falls in the back of your mouth, a lot of times people swallow or they cough. Those things can go into their airway. So it's always very important that you have isolation. You're protecting the back of the throat. So this is a rubber dam. Basically, it isolates this area that we're working on from the rest of the mouth, and allows us to do our work and keep everything nice and clean. This is what you get outside of a tooth when you're doing a root canal. This is actually how a nerve looks. They don't always come out like this, but in this instance, this is what this one looked like. This is us about to take an impression for a patient who had some dental cosmetic work done. The front 4 teeth were crowned due to extensive decay, built up, and it seems like my slides might be out of order here. So just give me 1 second. Those are temporaries. There we go. Let's see. Okay, so this has nothing to do with IV sedation dentistry, but this is a day in the life of a sedation dentist, right? If you're running multiple rooms, you're seeing multiple patients a day, you may have a patient who is coming in for sedation appointment where you may be doing extractions, wisdom teeth extractions, a root canal, and then you also have patients that are coming in for orthodontic treatment. Now you can see this patient's teeth started off one way on the top, and then this was the patient as they progressed through treatment. This is another patient here. She came in for sedation. She had extensive medical history. She was taking medication that dried her mouth out. She was a grinder. She was also very fearful of the dentist. So she needed a crown on almost every single tooth that she had. Now, sometimes it's really important that if your patient comes in needing extensive work, you do have the opportunity to provide sedation dentistry for them. It encourages them to get more dental work done at one time, which is more profitable for you. And also it's less stressful. You're able to manage your patient. They're not huffing, they're not puffing, they're not tired. They're generally sleeping very relaxed. And once your patient is relaxed, usually the dentist, the dental assistants, everyone is very relaxed after that. So this is the inside of her mouth. We kind of built her teeth up, as you can see. And if you look right where that blue thing is in the back of the mouth, that is one example of why you have isolation in the mouth. If that little particle goes down her throat, it's not a huge deal if she swallows it. But if it goes the wrong way, then you're in trouble there. And so we isolate for those reasons. Now, the wear on the teeth is the circles on the teeth is from wear. It's due to grinding her teeth, and the dark spots in the wear facets, which is the circles in the teeth, that is due to decay. Now, I would like for you guys to make sure you know what that is because there's going to be a quiz I heard afterwards. So make sure that you write those things down. Now, if you're thinking, I'll give everyone just a second to think, what will we do for this patient? How will we help her to restore her teeth to optimal dental health? And if you're thinking crowns on her teeth, which is a full coverage restoration, which means it kind of a crown fits on a tooth like a hat fits on your head, is what we kind of tell patients. So all the decay, all the wear, everything has to be reduced to a certain millimeter height and then restored in that same way. So you can see here, obviously, because we have so much wear on the teeth are shorter. Also, because of the extensive decay, some of the teeth end up needing root canals. So it's really an awesome thing when you're a general dentist. You can provide all of dentistry, all of the dental services to your patients. Now, a lot of providers don't like to do root canals, but it's really important to want to be involved in all aspects of dentistry. Now, certainly you can cherry pick, but a lot of times patients, when they come to you as a patient, you think about when you go to your dentist or when you go to your physician and there's someone else there, you're like, well, where is my provider? Where is the person that I know that I'm comfortable with, that I trust? So you build that rapport, which is also something that you should be working on, your patient relations, patient communication, just communicating from person to person. A lot of times we learn all the science, all the medicine behind what we do and why we do and how we do. But we forget that these teeth are attached to a person who has feelings, who has emotions, who has, things that, a personality that we have to figure out how to maneuver and getting that person to trust us. Now, every patient is not going to be, your cup of tea, but you should be able to know how to help and relate to any patient that comes in the door. So obviously you can see in this case, her gums are bleeding. You can see in her nose, it's a nasal cannula. Oxygen flows through that because we're monitoring also her oxygen levels. And when you do IV sedation, the main drugs you're going to use, and you can write this down, fentanyl and Versed. These things cause respiratory depression. Their onset is pretty quick. They last usually about 15 to 20 minutes. So every so often, depending on how these medicines affect your patient, you're going to be giving your patient different doses of medicine every 20 to 30 minutes. So in the operatory for every sedation appointment, there's the dentist who is the provider, there's a dental assistant, and then there is one person that's dedicated to monitoring all of the vital signs for the patient. We're monitoring their CO2 levels, their oxygen levels, their blood pressure, their heart rate, their respiratory rate. So all those things are important because it tells us that our patient is still alive. They are still okay. We're not in any danger zone of the patient's heart rate going too high or too low or anything else. Also, these vital signs help us, they give us context clues. Because the patients are sedated, because they're sleeping, most of the time they can't really communicate with us. If the patient's agitated, if they're moving, generally, that what's wrong is that your patient is not numb. If you're working and the patient's moving or they're moaning, with these medicines, it's moderate conscious sedation, but you can achieve deeper levels of sedation. But you have to know how to dose the patient. You have to know how to read the patient. It really is an art and science to everything, and it's honestly like anesthesiology. You don't know. There's no cookbook on how to sedate a patient. You have to read the patient. You have to read their vital signs. You have to know what works for them, what's getting them in a certain sedated state. And also, when we're recording, we're also recording their Ramsey score, which basically tells us how sedated the patient is. All these things are required by law to keep record of, and it's honestly to keep the patient safe as well. So continuing on through this case, you can see we cleaned everything up. We did the root canals. We built the teeth up. In the gums, they look pretty dark. That is called retraction cord. It basically pushes the tissue out of the way and allows a space for impression material to flow so that we can capture an impression of this, of the preps, so that we can send them to the lab so they can fabricate crowns for the teeth. Now, when you're thinking about an impression, think about when you're taking a picture. Well, actually, you guys might be pretty young, so you might not know how the regular cameras with film are, because we really take everything like pictures with our phone. Everything's like digital. We don't have like the actual film. Well, a lot of people don't. But anyway, so this is like the negative. The impression that you get is like the negative. So it needs to be crisp. It needs to be clean. It's exactly what you need to get a beautiful, amazing fitting product. So you want to make sure all the tissue is clean. There's no bleeding. Two things can occupy one space. So wherever you're trying to get an impression of, it needs to be clean. It needs to be dry. It needs to be no blood, no bleeding, anything like that. So when you see how this looks, that you see the darkness around the gums, that is what we're preparing for an impression. These are the teeth that we got from the lab. These are crowns of her teeth. Usually when my lab cases come back from the lab, I check each crown to see how everything's fitting, if I like the color, if I like the shape, if they did exactly what I asked them for, at the lab. You're going to be picking your color with the patient, obviously. A patient will come back for a separate appointment for that, or if you have talked to them beforehand, which typically happens, you can pick the color of your teeth. We call them shades. There are lots of different shades that you can get. If you've seen, lots of people get super white teeth. These are fairly white, but they still look natural. This is the patient's teeth. Now you can see her top teeth almost cover all of her bottom teeth. What is the reason for that? Why do you think that is the case for her? And if you were thinking because she grinds her teeth, that is absolutely right. So when you grind your teeth, you're actually decreasing the space in between your top and your bottom teeth. So when we did her bottom teeth, we had to actually open her bite, which means we had to give her more space in between her teeth so that she can function properly. And when she smiled, she is able to show more than just, that 1 millimeter of tooth structure for her bottom teeth now. You can see her gums look very healthy. Everything looks really beautiful. So this actually gave the patient a huge boost of confidence. She felt happy that she could come to the office and be sedated, not really know or be completely aware of what she was getting done. If you've had dental work done, you know that, there's kind of no way that you don't really know what's going on. I've had a feeling before. You can still hear the drill, even if you have headphones on, or if it's a laser, whatever it is, you still have some sensation. So this kind of puts the patients at ease a lot more, and they're usually very, very happy. So she was very happy. This is also like a walking billboard for me as well. So she can say, yeah, I had people might say, oh, well, like you're smiling now. I've never seen your teeth. I've never seen you smile. And then she tells her friend, oh, well, my dentist did my work and I was sleeping and I woke up and I had this beautiful smile. So you get more advertisement like that. So you see what she started with at the top, and at the bottom, that's what she ended up with. Now we still continue through her case. I don't have the bottom pictures though. That one was a little bit more involved, but she was a very happy patient, and that was a really fun case, very rewarding for everyone who worked on the case, because we not only helped her with her dental anxiety, get her oral health back to an optimum level, we also increased her confidence. And day to day, that's when you give someone a new smile, the first time you guys experience that and the gratitude that you feel from those patients, it is life changing. It's not like a high, it's like a really, really good feeling that you've made a difference in someone's life. This is another patient. He was actually like a young construction worker. He hadn't been to the dentist in a really long time. Obviously, you can see his teeth are really broken down. The darkness there, I'll let you guys guess what that is. That is decay and or a cavity. It can eat through your teeth. If you are still biting with your teeth and you have extensive decay, you can break a tooth to the point where the tooth breaks off, or looks very, very jagged like his. We also sedated this patient, and these were his temporaries. We didn't really get any good photos on him. He was a little bit complicated, I think, this day, or it might have been kind of crazy in the office. But these are the kind of rewarding cases you get to do in addition to everything else that you're doing. Now, while you're doing sedation, you still have patients that are coming in for cleanings, patients that are coming in wanting sedation. So you have to be well versed in time management. So that's a skill that you guys may be learning right now, or trying to get better at. It just continues basically throughout your career as a dentist. And if you don't know, dentistry is lifelong learning. You will be learning for the rest of your life here, and that's what you want to do. So if it's not something that you want to do, always learning something new, always updating, this might not be the field for you, because you do have to constantly be updated and want to learn more, want to do more, want to be better, because the person down the street or the other people on this call, are going to be doing those things, and you want to stay up to date, not just for yourself, but also for your patients. This is another patient here. She needed a root canal, I believe, or she needed some crowns, extractions. She has some gum issues here. So same thing here. We had to take some teeth out due to, I think, financial reasons, and I think the patient not wanting to have, I can't remember what exactly she had an issue with. But at any rate, when you have two teeth on the side of a missing space, what do you call that? So you have a tooth, you have a missing space, and then you have a tooth. What type of restoration? Would it be a crown? Would it be a bridge? Would it be a veneer? Would it be a root canal? And if you guessed the bridge, that is correct. So the bridge is just like a bridge over water. It gets you from one side to the other. With a bridge in your mouth, it basically crowns the tooth on both sides of the missing space and puts a little tooth there, which we call a pontic. So this was the patient's outcome. No one would ever really know that she has a bridge there. While she wasn't sedated, we just were able to provide this service for her, and she was very happy. This is another case of orthodontics. So as a dentist, a general dentist, this is also, like I said, something that you would do. You have a tooth that is crowded out of the arch there. You can see on the left-hand side that canine is all the way out. When the patient opens, she has a tooth that's all the way in. So what do you think we did to help this patient out? We did braces, obviously, but what did we do to those teeth to help everything fit? And this is kind of where your perceptual ability can come into place. So if you're thinking that we took one of these teeth out, you're absolutely correct. And which tooth would we have taken out? And if you guess that little one in the back next to the one that was jetting out, that is the one that we took out. So we obviously always want to tell the patients or consult with them and say, hey, this is the result we can achieve for you, but this is how we have to get there. Obviously, she could have gone and done comprehensive orthodontics that may have taken 4 years or maybe 2 or 3 years. We did this case in about 7 months, and the patient was very excited. Now, everything doesn't line up exactly perfect, but that's not what she wanted. She wanted a straight smile. She wanted, if you look at her teeth, you can, you're like, oh wow, that's really nice. But if you look really closely, she has a little bit of symmetrical differences, which is okay because most of the time when you smile, if you go and look at your phone or look in the mirror, most of the time you don't see your bottom teeth. You see your top teeth only. And honestly, the older you get, the less of your top teeth that you see. And that is, so I'll just go back and show you the tooth that is on the inside that's sticking out. That is the tooth that we took out. Pretty much everything that you are going to learn in dentistry, you have to take continuing education classes on. When you, dental school is basically like your foundation. You learn the basics of things, but you don't learn really the how to of everything. I think fillings, you pretty much will learn that, and maybe extractions and a couple other things. But if you want to really perfect your craft, you will have to invest in continuing education courses. Those courses sometimes range from $1,000 to $5,000, or for me, IV sedation certification course. For me, I did sedation training in my residency program, but I didn't immediately use that skill when I finished residency and was out in the real world in private practice. So, because 2 years had passed, I had to take a new sedation course, and that course was about $14,000. So, definitely an investment. But when you think about what you're doing and how you are manipulating someone's, their ability to breathe, life or death situations, their oxygen levels, you don't want it to just be $5.99. You want it to be something where you're going to extensive training. So the training was about 3 weeks, for 3 weekends, 3 3-day weekends, and the days were really long. They were about 12-hour days. There's lots of other courses out there that you can do. Mine was amazing, but they're all definitely an investment. So just keep that in mind. Whatever you want to do, it's definitely an investment. Same thing here. This patient, he had some crowding, obviously, and he was referred to me by the patient who had the tooth taken out. She worked with him, and he said, oh, well, maybe she can help me fix my teeth. He didn't really want to be in braces for a long time, so we treated this case in about 3 months. The reason we're able to do these cases really fast because we're really just manipulating cosmetically what they have wrong and correcting that. We're not really correcting their bite. We're really just changing the appearance of things. So most of the time we call this adult braces because for adults, they're not really trying to change their bite. Most of the time for children or teenagers, you're correcting the bite so that the patient has a better jaw relations for the rest of their life. Those things can complicate breathing, sleeping, snoring, all those types of things. Same thing for this patient. Huge difference on him. You can see how those bottom teeth and top teeth are crowded and just now are nicely aligned. Same thing with this patient. He had mild crowding, but all adult patients. This was a cool case of a patient who was extremely fearful. She came in, you can see on the top picture on the left side, you can see this brown looking thing, and that's actually her tooth, which is very badly decayed and broken down. She ended up having to have a lot of teeth crowned, root canals. Same thing, she kind of had a collapsed bite, which just means that she didn't have any back teeth to support her bite. So over time, you would see more of her top teeth than her bottom teeth. The lower picture is how her preps look. We're getting ready for our impressions, like we said. You can see the tissues getting cleaner, drier, things like that. And on the left side, this is a list of things that we had to do for her. Those are the teeth that we took out, that she needed to have. The little white things are her temporary crowns that she left with, kind of like her teeth to test drive, see what she liked, see what she wanted to change, colors, things like that. But like I said, we always want to write down what we're doing. And this is a lot of work. So when you're scheduling, when you're doing lots of work, you want to think about or know, like, okay, this is my day. This is what I have to do. How am I going to tackle this? What's going to be the best situation for me going forward to manipulate this? When should I take a break? How much medication is the patient going to need? This is not necessarily a case that I would recommend doing without sedation, because it's a lot of work. It's a lot for the patient. It's but again, very, very rewarding. The patient ended up getting some everywhere you see bone graft, the patient got implants, and I think she had one extra implant on number 30. Anyway, the patient is now fully restored. She's very happy. She comes to the dentist now and gets cleanings and really, really takes care of her teeth now. What's also important is that because we are doing sedation on patients, we don't want to just say, oh, well, let's just sedate the patient and do the work, and then now we're just all big and bad, right? We want to also talk about or think about teaching our patients how to prevent decay, right? Now, we can think about it in a way like, oh, well, then we won't be as profitable, right? But we have an obligation to do no harm. So by doing no harm, we're actually educating the patients that it's important to brush, to floss. What happens if you don't? How it can affect your body. The bacteria can go through your body, to your heart, to any artificial joints that you have. You really can have lots of complications if you don't take care of your teeth or show your patients how you take care of their teeth. Sorry. So this is the patient. This is the patient who had thank you, who had all the work done. This is how her permanent teeth look. You can see her gums are nice and healthy now. When you look at the previous pictures, right, her gums they don't really look very healthy. They're kind of puffy, kind of red, not bright and pink. Now, just because the gums are pink or just because the gums are brown, that doesn't mean that they're not healthy. Patients who have melanin skin, so brown skin people, tend to have melanin throughout their whole body. And it also shows up in your gums as well. There's nothing wrong with it. It doesn't mean there's disease. It doesn't mean it's decayed or anything. It's just how it is. But you can see in that lower right picture how nice and clean and shiny her gums are. You want your gums to be shiny and tight. You don't want them to look puffy and red. Those are signs that you have gingivitis or other periodontal issues. So this patient was very happy. Again, she started here, and with the help of IV sedation, each time she came in, she was able to get to this, and she was very happy with the results there. Oh, also, as we talked about protecting your patient's airway and understanding that concept, you can see the gauze in her mouth. That is because we didn't want anything to come off, any little pieces of anything to go down her throat, because at this point she's very sedated. She's sleeping. So anything that goes the wrong way could cause her to cough and just mess up any of her dental work. The interesting part about knowing how to maintain your airway is knowing which drugs that you can use. Now, there are different dental boards allow sedation dentists to use different drugs, but that doesn't mean that you should use those. Because we're doing a lot of work in the mouth that involves a high-speed handpiece going at lots of RPMs and high torque, that can actually burn a tooth. So you have to have water. With a lot of water in the back of a patient's throat who's sedated, is sleeping, right? Can you imagine having your mouth open, you're sleeping, right? When you're sleeping, you're inhaling, exhaling, right? So any of that water can go down your throat. So you have to know what drugs are going to be safer to use in those instances where your patient can actually still maintain their airway and their ability to breathe. A lot of times when you use propofol, which is also a sedation drug, patients lose their airway, meaning they're not able to maintain that airway. They end up coughing a lot. They end up having really bad experiences. So this is why we don't do a lot of sedation dentistry in the OR. most of the time those patients are intubated. So you think about where that tube is going in their mouth, and how are you going to do your fillings? How are you going to check your bite? How are you going to do maneuver around that big, you know, airway piece? So this is why IV sedation in the general dentist office is a very, very powerful tool. It allows you to do a lot of things that you normally would not be able to do, and you are pretty much like a mini anesthesiologist. Most of the time, patients come in, they are to be sedated, they're getting their wisdom teeth taken out. One question I will let your moderator ask you is, which teeth are the wisdom teeth based on this x-ray? This is called a panoramic x-ray. It shows all the teeth, and we have 32 teeth, and I will let her ask you that question, and I'll give the answer to her. So at any rate, this is how the teeth look when we took them out. Again, we always are writing down what we're doing so that we know. We always look at the teeth when we take them out so that we make sure that we get the entire tooth out. I think I'm getting to the end of my presentation, but this is a picture of a tooth that needs a root canal. I was telling you guys about before. Yeah, so I think my slide was out of order. But this is a tooth. The top picture is a picture of the tooth without a root canal. The bottom picture is a tooth with a root canal. So you can see the tooth is kind of badly broken down. It's pretty short. There's lots of decay on that tooth. But the patient has just one tooth back there. So this, if you're taking physics, this kind of goes back to your physics. You need to have things taking up different forces. If there's no teeth in the back, all the force of your jaw joint is going to go in your front teeth. And what does that cause? A lot of wear on the front teeth. The front teeth become shorter, or they become fractured. You have to take them out. Really, everything that you're learning ties into dentistry right now. Your biochemistry that you're taking, all of that helps with knowing how to navigate, determining which medications you're going to use for a patient, or what medications they're taking that may not be compatible with drugs that you may enter into their system to sedate them. So everything that you're doing right now is going to be repeated, to be honest, throughout dental school. It's important to get everything that you can get at this level, because it really, from this point on, builds until the time until you keep going through, after you become a dentist. If you do training in sedation, if you do training in Invisalign, anything and everything that you do, you have to know, you have to take it all and put it all together. So take the little bits, make sure that you're, putting in the time to understand on the level that you are on now, so that when you get to the next level, you can just build upon that level. And then when you go on, you can still understand. Because if you miss one, when you get to the next level, it's going to repeat itself. And if you don't understand it, if you didn't understand it before, you won't understand it then. You have to go back and then try to go forward. And you never want to be behind. So that is my basic presentation. I think right now I will take any questions that you guys have for me on anything.
Yes, thank you so much, Dr. Wheeler, for all that advice and the interesting cases. So, like she said, we're going to move on to the Q&A session. So if anyone has any questions, you can leave in the chat and I'll be checking that. And so for right now, I have some questions actually. And I'm going to take you back to your dental school experience. So the first question is, what criteria did you consider when choosing a dental school?
So for me, when I was choosing a dental school, I knew that I wanted to go to an Hbcu because I went to an Hbcu for undergrad. I had a cousin that went to dental school at Meharry. She was an amazing dentist. I visited Howard. I visited Meharry. And I liked the environment at Meharry. better than Howard. And I'm not saying that Howard's not a good school. For me, it was what I was looking for. And I had a really great experience in dental school. Dental school is hard, absolutely. But you you get out of it what you put into it. Your relationships, always build relationships with your classmates, with your teachers, with the class ahead of you, with the class behind you, because those people become your peers in life. And for me, all of those people look like people that I could relate to, people that I could talk to, people that I was comfortable enough to be around, because these are your family. You're going to be eat, study, sleep, repeat. Like that's really your life, with school mixed in there, classes mixed in there. So you really need to get into an environment, research the schools, go to visit the schools, ask the students, what's been your experience? How do you like it? Those are all really important things that you need to do for dental school, and even when you go to residency too. So you have to get more than one person's experience of what they like and what their true experience is, and how comfortable you are. You can ask for the demographics. Actually, I think those are all listed on all the dental schools, their websites. But that was important to me, to be around brown African American people. It was I went to an all girl African American Catholic school. I went to an HBCU for undergrad, and that was where I was comfortable, and that's why I chose the school. And it's also a really, really, really a good school.
I think you touched on it a little bit, but someone in the chat, Carrington, is asking if you could talk about your experience at an HBCU for dental school.
Yeah, so really it's the same. So all the curriculums are the same for all of the dental schools. My experience at HBCU is just that there were more African Americans in my class than not. Some schools, they don't. You could possibly be one or two African Americans. Sometimes that can be challenging. You can relate to things. You have more things in common, and it's just a different culture when you're around like-minded people. Sometimes, as just humans, right, we gravitate towards things that we relate to, or that we, how we are alike. Now, that doesn't mean that that's all you should be around. But sometimes when you're in challenging environments like dental school, you need to have the ability to lean on your peer. And sometimes, in our world, and, it's just not something that is easy for people to do sometimes when they're not from the same backgrounds. They may gravitate towards people who have those same backgrounds. So if you might be the only African American person, and there's, Jewish people, Hispanic people, everybody's pretty much, most of the time, gravitates towards people that they're like. But I don't think that, going to a non-HBCU is a bad thing. For me, that was a decision that I made. Something important to me, my personal beliefs and my personal preferences. But I think all the dental schools are great. I've had friends that have gone to, all white schools or majority white schools or wherever, and we all learn the same things. We all take the same national boards. It's just, what is your preference? Where do you want to live? What environment is that? I can't imagine going to school in the Northeast, like in New York or something, because I'm from the South and I don't like the cold, so that wouldn't work for me. So think about somewhere you're going to be okay with being for 4 years, because that will be your home.
Thank you for the advice. So we have another question in the chat from Peyton. She says, what made you choose sedation dentistry versus other specialties?
So sedation dentistry, for me, actually, I was in a group practice, and we were just seeing lots of patients. And at the time that I was going into sedation dentistry, actually was pregnant, and we were testing out anesthesiologists, actually saying, like, okay, sedate our patients, we'll see how this is going to go. We're going to use propofol. Number one, it was expensive because to get an anesthesiologist and MD to come into your dental office and just sit there and just push drugs, that's very expensive. But also they couldn't manage our patients. They couldn't manage the patient's airway. There was just water going down. The patients were coughing. They just didn't understand what the patient needed to have a certain experience, what the patient and what the doctor needed, what the oral environment should be like. So for me, I was like, okay, well, I need to do IV sedation because I can be profitable, do a lot of surgeries, do a lot of treatment on patients, and them be comfortable and me be comfortable as well. So I looked into it, and I found out about it and found a course to go to, and that's what started my journey. I did not like surgery when I started out practicing. I liked crowns and all the pretty stuff. I didn't like surgery because I thought, well, we're just gonna do all this cutting and stuff, and then we're just gonna throw the teeth away. But it actually is like the number one thing that you do as a dentist is an extraction, right? It's pretty much your number one money maker. Someone's always gonna be in pain that you need to take a tooth out, and a lot of people are very afraid of needles, very afraid of pain, and so that's where my experience, or that's where my desire to do sedation dentistry came in. There's not a lot of sedation dentists in America, and I think it's because of the high cost associated with it. Also, when you do sedation, you do sedation dentistry, you also have to have a higher level of malpractice insurance, so that's obviously more expensive. But when you look at the return on your investment, which is, your $14,000 course or whatever, you make that money back very fast. So I would not ever not do sedation dentistry because it's very fun. You can also do a lot of training. You can teach your assistant. You can talk over the patient. You can just really become a high level skilled dentist because you don't have to worry about my patient is ready to go. Let me hurry up and do this. You can take your time. You can do the best job that you can. Nobody wants to sit in the dentist chair for 3 hours, for 2 hours. So with sedation dentistry, it allows you to do longer appointments, more extensive cases, harder procedures. So if that's the kind of dentist that you want to be, you should consider sedation dentistry. And for me, that's where I was in my career. I wanted to become a really good dentist. I wanted to really just perfect my implants, my wisdom teeth extractions, my cosmetic cases, my root canals, every single thing. So it allowed me actually to become pretty highly skilled. Next question.
Yes. So another question is, what is some advice or tips that you would tell your younger self when getting out of dental school and looking for an office or going into the workforce?
What I would tell my younger self is what I should have done is pursued my sedation training when I finished residency, because then I wouldn't have to pay $14,000 or the time. But it was a great experience. But no, I think that one of the biggest things that's really, really important is to make sure you maintain relationships everywhere you go. Always push yourself to be better, to do better. Surround yourself with people who are doing the things that you want to do and learn from them. Mentorship is the most important thing that you guys right now should really invest in. Find a dentist. It can be a young dentist. Go to their office, hang out with them, ask them questions, try to see their cases. Those things are really important. And sometimes it's not what you know, it's who you know and how you relate to people. And sometimes that is bigger than anything. Your relationships with people, they will take you very, very far, even just your patients. So that's pretty much what I would tell my younger self. I would say I was very calculated, and I planned out the end of my dental school career, going to residency and then going into private practice pretty pretty well. So I felt like I made the right choices. I wouldn't go back and change anything. Um, I would say research the things that you're trying to invest in. If it's a residency program, if it's a job, if it's an opportunity, whatever it is, just research it. Ask questions about it. Get all of your information before you make any of your decisions, and really weigh those options very hard and say, is this, what is my end goal in 3 to 5 years? Where do I want to be? What kind of dentistry do I want to do? What kind of dentist do I want to be? What kind of person do I want to be in my dental community? And then you do everything you can to achieve that and accomplish that.
Yeah, like you said, dentistry is a people career and it's also an evolving field. So, my next question would be, how do you keep up to date with all the new technology? And could you talk about some of your favorite technologies that you use in the office?
So I really like, sedation dentistry is going to be my number one thing. um, Also, lasers and CEREC crowns, so same day crowns, those are also really, really amazing things. There's 3D printers now. There's so much technology. The way you keep up with the technology is to become involved with your organizations like the Academy of General Dentistry, or the American Academy of Cosmetic Dentistry, or your implant organizations. When you go to the conferences, which they have every year or 2 years, depending on the organization, there's scientific components of all of those meetings. And basically, a lot of times the companies who come out with these new technologies, they're there. They let you use the things, they let you test it out, they show you what they can do. So that is one way that you keep up with the technology. But this also goes back to your relationships with your classmates in dental school. Someone may know, they may have their mom might be a dentist and she does laser dentistry, and then that person is a big laser dentist. You can call your friend and say, hey, I know you guys use this laser, what do you think about this? Like, would you recommend, can I come and see how you guys use it? Those are all ways that you can keep yourself up to date with the newest things and technologies. Continuing education courses is also one of your main ways to do that as well. There's always different protocols. There's always different people saying, this is what I use. This is what I do. Let me show you. And most of the time, those continuing education courses are really fun. There's either, drinks and dinner after, you're socializing, networking, all of those things. And also, every state board of dentistry has a certain requirement of continuing education hours to keep your dental license active. So it's almost forcing you to do that. I mean, you can certainly get around not doing like major courses. But that's why it's also important to say, this is who I want to be as a dentist. This is the kind of dentist I want to be, and then you do everything you can to get there. So you're not going to just be the dentist who does the bare minimum hours, that doesn't do any interesting courses, that just does maybe the free courses that don't really showcase or show you how to do any new technology or deal with any new technology or learn about any new technology. You want to be on the cutting edge. And also, evidence-based dentistry is really, really big as well. So when you sign up for these organizations, they normally have monthly journals that they publish, and there's always articles in there talking about these new technologies and new products and new techniques in dentistry. So if you're on an island and you don't have any friends, you haven't related to anyone, you haven't gone to any conferences, you don't do anything, you're going to be operating on this little tiny island by yourself. And dentistry, just like any type of medicine and anything, any career, honestly, it can be really stressful. So you need that support system to lean on, to call your friends, say, hey, were you doing those fillings? Like, I hate doing those fillings. They make my back hurt, or they're so technique sensitive, or what technique do you use? How does this work for you? And you always want to share, your successes and learn from your mistakes and share the mistakes as well.
So
Any
the
other
next
questions?
question, yeah, the next question is more of a personal preference. So, what would you say is your favorite procedure to do?
My favorite procedure to do is a root canal, actually. I love root canals because you really have to use your mind's eye and your knowledge of where something should be inside of a tooth that you kind of can't really see into. To do a crown prep, you don't really know where the nerve canals are in a tooth. You know, generally, ideally, where they're supposed to be located, and that's something that you learn in dentistry. I mean, in dental school. But when you enter a tooth, no tooth is the same. So you really have to use your mind's eye to figure out where you're going, what you're doing, and safely do a root canal. Because if you're going at a certain angle in a tooth, if your tooth is this way and you're using an instrument and you go out this way, you can perforate the tooth, which means you make a hole in the tooth, and then that tooth then is no longer able to be restored. It has to be extracted, and then you have to think about doing an implant. My second favorite will be implants, and I'll just stop it there.
If not, the list keeps on going.
Yes.
So the next question is, how does you or your office deal with emergency patients that like don't have appointments and just need to look out like right away?
So we never try to turn anyone away. If a patient comes in and they absolutely have major swelling, or they're just in so much pain and they just walk in, we always try to help everyone that we can because we feel like that's our duty to that patient. Also, sometimes with finances, for patients who are just really unable to pay for things, we may take a tooth out for free. It takes nothing to take a tooth out, right? So you always want to try to help people as much as you can. Now, obviously, if every single room in your office is full, the patient will have to wait, but you try to help people as much as you can. And that's without giving them a prescription and just saying, hey, go away, I'll see you another day, I can't see you today. You always really want to try to help people as much as you can. So that's the philosophy that we have in the office. And it makes people feel really good because I think in the community, people know, hey, if I have something that I really need an emergency, I can go to this office. I know they will take care of me. But it's not like you're handing out free dentistry. You are really just helping people who are really in need. And that's a good feeling. You want to help people. You don't want to just be in dentistry just to make money. So that's how we handle our emergencies.
So I think we have time for two more questions, and they're going to be a little more general.
Okay.
So one of them is, what made you want to become a dentist?
Oh, that's a big question. So I always liked science and arts and like kind of how things worked. So that always just kind of worked for me. Dentistry. I did a lot of science programs growing up. And I knew I did not want to be a physician. And if I did want to be a physician, I would be an anesthesiologist. But I felt like with dentistry, you could see a problem and solve the problem. And in medicine, and I'm not knocking medicine, it's not that way. You really have to figure out, you're trying to figure out, well, what's actually wrong with the patient? Well, if I give them this medication, is this going to help them? Or is this just going to improve their symptom, right? With dentistry, it's a very absolute kind of science, right? If a patient has a tooth that's bombed out and infected, what's going to stop them from having that pain if you take that tooth out. So that's what I love about dentistry. That's why I became a dentist. I feel like I'm able to specifically solve problems. So I'm a problem solver. I like to solve problems. I like immediate gratification. Those are all things that went into me wanting to become a dentist and knowing that that was the right path for me. But as a kid, I wanted to be a dentist. I felt like it was just my dream job. And I started shadowing a dentist when I was really young. And I think it was like 8, something like that. And it's just been my passion for sure. What was the last question?
The last question uses a little bit of creativity. So it's, if you could change something from the dental field, what would it be?
All of our stuff tastes awful. It tastes terrible. Any anesthetic, the topical gel, all of that stuff, it tastes really bad. So if that's one thing I could change, I would change it. I think it would make people have a better experience. But scientifically, we're just not there yet. And sometimes some things just should taste bad. So that's probably one thing that I would change. And I think the other thing that I would change is that, the field of dentistry is changing. There's more minorities, there's more women. So dentistry is becoming a more of a gentle field. A lot of times, people have had experiences with like big men with big hands, and then they hurt them, and then they're scared, But I think people are more compassionate now. There's obviously advances in dentistry where you're able to numb the patient and have different approaches. Um, and so I really love that aspect. I don't know if that had anything to do with what you asked, but I think that's um, something to worth noting for sure. So just because you don't see a lot of dentists that may look like you, that is always changing. And people, I think it's important for everyone to be represented and every patient to be able to identify and relate with people that look like them or maybe that have experienced things that they have experienced. That is very important.
Definitely, not only in dentistry but in any career. And you were really looking out for your patients with that answer about the taste.
Yeah.
So I wanted to say thank you again for your time and for being here today and for the advice. Love the presentation.
Yes, and if anyone has any questions or would like to reach out to me, you can send me a message on Instagram, and I will get back to you. Any question about anything, it's nothing that I wouldn't answer. So let me know if you guys have anything that you need. If you want to see any more cool cases, let me know and I can share some with you. I don't really put them on my Instagram profile because everyone has that, and that's pretty boring. So most of my Instagram stuff is pretty motivational and encouraging with a little fun. But in my Instagram stories, that's where you see most of my dentistry. So with that, I'll say thank you for having me, and I hope you guys enjoyed and I didn't talk too much. If you're interested in IV sedation, or if you're in the North Carolina area or in the Atlanta area, let me know, and I would love to have you come to the office.
Thank you.